Hi, everybody, and welcome to the Hanley Effect. I'm John Dybin.
I'm Rachel Dosicle.
How you doing, Dr. D?
I'm good, Dr. D. How are you?
I'm great. We're trying something new. It's
We
a
are.
different thing. And so normally it's not awkward at all, this
No.
part where we're just chatting
No.
because people can't yet see that there's another person here. But right now we're making our guest feel as awkward as humanly possible.
Yes. We're looking right past her as if she is not here.
I love the challenge.
I knew you would. We are really, really honored to have you here today. Katherine is the CEO of NAMI Palm Beach County. And if you're not familiar with NAMI, that's the National Alliance for Mental Illness. It is an amazing organization, and I'll let you talk about it. But Katherine, we want to thank you, first of all, for being here, for being with us, for putting up with our antics.
There were a lot of antics before we started, and you're a good sport.
I'm going to come back if you let me, because it's a lot of fun.
It is, right?
Okay.
And we got more antics to come.
Okay,
We don't have to stop. But we love, thank you for being here. We love to have people tell us a little bit about who they are and what they're doing now. And then we really love to know whatever you're happy to share with us about your journey that got you to where you are today. Katherine, welcome and thank you.
Thank you. Thanks so much. I'm so excited to be here. And I also don't know where to look. So I'll just kind of go back and forth. But yeah, I grew up in Palm Beach County. I went to school right here in Palm Beach Gardens at Gardens High School. I went to Belvedere Elementary School. I'm a Belvedere B. So I have a lot of time here in Palm Beach County and have just really enjoyed building my career here. But I went to school at the Evergreen State College in Olympia, Washington. And that really helped to set the course for my professional career. I received a bachelor in liberal arts, and I was very interested in public health initiatives. So HIV prevention, public health, women's health. And so I did a lot of projects through running the community health project, the Women's Center. I got involved in the Office of Sexual Assault. And so I was just really
This
interested.
is an undergraduate student. It's amazing.
So that's amazing.
Yeah, Evergreen's an incredible college, and I just took a lot of leadership roles in trying to promote health, especially on campus and then in the greater community. And so some of the projects I worked on were volunteering with our local HIV/AIDS organization, doing testing and counseling, and also volunteering with Thurston County Syringe Exchange. And that was really pivotal in my understanding of harm reduction.
Yes.
And of really understanding, meeting people where they're at and trying to just help them for the best possible outcome and then connecting to care. But those are really important experiences for me, especially working in Syringe Exchange. And we'd park in these kind of interesting parking lots outside of, big box stores, and families would pull up, sometimes with kids in the car and, just like very heartbreaking things. And, I just felt so much for individuals who were trying to do what they could to help themselves and improve their outcomes. So that really stuck with me. And when I moved back to Florida after I graduated, I've worked in a couple different nonprofits, working within mentoring programs, and just always was interested in that community health education. And then I was very excited when I got brought on to NAMI almost 10 years ago now. Started as program director, and then about 3 years ago, I was promoted to CEO. So it's been a bit of a journey there.
Amazing.
It is an amazing journey. It's funny. Beforehand, we were talking about and I wouldn't do a commercial for Evergreen State College, but it's funny. It's a place I've never been, but everybody I know who's been there, part of that, has these incredible stories and incredible passion for making the world a better place. So I don't know anything about it, but I'm going to find out about this place that you guys are going to. NAMI, can you tell us a little bit about NAMI and as an organization in general, but then also here in Palm Beach County, where your home and your focus is? What is NAMI?
Absolutely. So we're the nation's largest grassroots mental health nonprofit. NAMI was started in 1979. And if you can imagine the parents and, loved ones of people with serious mental illness at that time, it was a very desperate situation.
Right.
For our 40th anniversary, I was going through all of our old records, and I found just these very desperate letters from people. I found all of this information about them looking to find people who were missing, who had serious mental illness. So we didn't have all the technology then. And so the families were just so desperate, and their loved ones would just go missing, and they had no way to find them. And so it really came out of this desperation and this need, and they came together. All these support groups from around the country met up in Madison, Wisconsin in 1979, and they formed one national organization.
Wow.
We were doing that locally. We had a support group. It was meeting at Mental Health America. And then in 1983, we joined the national organization. So we were just doing exactly what people all across the country were doing at that time.
That's fascinating, though. I mean, the loss of loved ones is what led to NAMI being created. I had no idea, and I that never would have been my guess. Wow, that's a powerful place to start.
And families were still being blamed at that time for their loved one and the behaviors and, the experience of having schizophrenia in the late 70s was just, very dire. And that's really what NAMI came from is, really trying to, the families coming together to help the people who maybe didn't know that they needed help. Maybe the help wasn't available or wasn't competent. So it really was just the families needing each other. So in 1983, we formed as part of the larger organization. So we've been going strong and, NAMI started with the family caregiver. But then, of course, with the rise of the disability rights movement, nothing about us without us, NAMI's gone really strong into the peer-delivered services as well.
So for people who is, because there's a lot of, it's a very broad audience. What does that phrase mean? Nothing about us without us.
So, the people who have the conditions, whether, whatever disability or condition that is, they should really be providing the insight and leading the way. The family caregivers, the professionals, they're all important, but the voice of the people who are going through it is what really matters as we're trying to figure out how to provide that support.
It's such a beautiful thing and it's funny. I guess I've probably known this, but I don't think about it a lot. NAMI's been around for a long time. And the idea of, if you go back to the 70s, I mean, mental health was really people who had no mental health disorder, right? There was no concept of having a person who actually struggled with something have a voice in understanding it or treating it.
Much less human rights. I mean, people were treated just terribly. This resonates particularly with us. As you know, Hanley has 10 inpatient mental health beds. And so for us, this is a big part of our practice and ensuring that our patients are treated with respect and with dignity and, are part of that therapeutic alliance is really, really just a critical component.
It's at the core of what we do as well. And actually in our bylaws, 50% of our board of directors have to have lived experience. So either they themselves have a condition or they love and care about somebody who has one, just to make sure that we're always centered. We have a peer council and their president is appointed to our board of directors. And again, it's just to make sure that the people who are receiving the services or the people who are impacted by these conditions have a voice at every level of the organization.
I love that. It speaks to the reality that people are people and our conditions are not who we are.
Yeah. But
everybody with an experience has to have a voice or else you're just going to end up with, so thinking about so I'm a person who has people who I love in my life who have struggled with mental conditions, mental disorders, who've struggled with addiction, who've struggled with, and I know a lot of people listening. Well, be in that boat. What are some of the things that NAMI has that they could access here in Palm Beach County? Some of the resources that might be helpful for them.
So for the family caregivers, have a lot. We were started by the family caregivers. Our programs are led by and for family caregivers and the family suite. And if I could kind of break it down for a little bit further from the top, we divide out generally family programs, peer programs, and then kind of blended or community programs. And then within the family and peer programs, we have classes and support groups. So there's a complementary program on each side. So for the families,
so family members and people they're going through, and the persons affected are They're going through things at the same time.
And it really works very well when the family and the loved one who has the condition are both in our programming, because they learn a common language.
That's brilliant.
So, and that looks like we have the family support group and we have the peer support group. We have the family to family course and the peer to peer course. So they learn about communication techniques, I statements versus you statements, reflective responses, really, talking to listen to each other and hearing what the other person's saying. And sometimes if a peer will go through a program and their family member's still speaking to them in a way that doesn't, hit right, there might be a little conflict there. But when both parties are participating in the programs, they have a shared language and a shared understanding.
Yeah. That's so powerful.
I love that.
Yeah. So powerful.
So then within the family suite, we have the support groups every Wednesday night. We have a support group on Zoom so people can jump onto that. And it's increased access. Before the pandemic, we met all across the county in various locations, and it'd be once a month. You'd have to drive. A lot of the family members we serve are elderly. They might have adult children. And so that's really increased access for them. So that's every Wednesday night. They can just go online and join us and learn from other family caregivers.
Tell us your website so that somebody who's listening knows how to access this.
That's NAMIPBC.org. And I don't know if you broadcast outside of the county. A great thing. And a lot of family caregivers, they, or their loved one might, be someplace else for treatment. So the great thing about NAMI is you could also search, find your local NAMI, look for a support group and find one near you.
Yes. So good.
So if you have people here receiving treatment, but their family's living in another state or another county, they could find their local NAMI. And that's the power of NAMI, is that there are over 600 throughout the country. In Florida, we have 20 NAMIs, and the program will be similar where you are. So we have fidelity to a model. So if you're doing a family support group in Connecticut or California or West Palm Beach, it should be led in that same way.
That is so important. I hope everybody heard that. That's a beautiful, beautiful model. It's funny. You're talking about the online group. I remember prior to the pandemic, everybody thought like that stuff's never going to work. I'm a family therapist, and the first time I was going to do family therapy in Zoom, I thought this is going to be a nightmare. And I have found these meetings are incredibly powerful and effective. Have you found that too?
Of course. Yeah. And it was a bit of a learning curve in the beginning. I had to walk a lot of people through utilizing Zoom. And now,
you probably still have some you have to.
We try to help people along. I would actually get online and do practice sessions with people. If they wanted to join a group and they weren't sure, I'd take time with them. I'd say, let's practice getting on Zoom. I'll schedule a meeting and work with you on this, because we really try to increase the access for people so that they can, participate fully.
I love that.
So Hanley is collaborating with NAMI. You want to talk a little bit about that?
Yeah. So we have an incredible partnership right now. We've been working with young women who are at the Department of Juvenile Justice, offering them a support group.
Good.
And within that group, we do a lot of skills from a novel program we created locally, which is called Integrative Resilience Training. And so we're bringing different techniques into the DJJ and working on, really understanding their responses to the adversity that they face and what is in their control, what techniques that they can use from anywhere, free, easy things that you can do, breathing techniques, butterfly tapping, all sorts of just different regulation, mindfulness techniques. And that's just been really incredible. We had one young woman say, I never thought I would like meditation, but now it started to resonate with her. And so we also do an activity around, like I said, understanding what is within your control and what is not. And so, we use different hand models and help them to just understand a little bit more in a tactile sense. And it really works well with young people. And one of the things that my colleague will do is showing people kind of the hand model of the brain and understanding, you have your prefrontal cortex and, you've got your little lizard brain inside. And when you lose kind of control, you flip your lid and you have your lizard brain responding. And they really love that, because they can relate.
I'm stealing that.
Yeah.
Why have I not seen that?
It's a really neat thing and one of the students mentioned that, that really stood out to her because, if somebody experiences, some anger or, just emotional responses, and then it can make sense. So it really normalizes the different emotions that you're going through.
And it's so powerful because especially as kids, but even, is adolescents, when they have that moment of flipping their lid and, so often I see these great kids, I've raised some of these, right? Great kid. And they flip out our lids, and because they are just wonderful, they're like, oh, I can't believe I did that. What's wrong with me? And man, when you understand it's not you, that's just what happened in your brain.
That's right.
You're more than that. You're still that wonder. That is so powerful because so many kids, especially in a juvenile justice system, which, they've already got, they're labeled and branded. There aren't going to be a whole lot of people saying, no, when you lost your temper, that doesn't define who you are. You're more than that. So that's, I don't know. That just really moved me. I still have, I've raised an adult daughter and I have a teenage daughter still. And that just really fills me with gratitude because that's a powerful thing to give to someone. You are not your mistakes. You're not your problems, your struggles, your disorder, any of the, you're more than that. I love that. Sorry. That just got me really excited.
And that's what's one of our principles as well, is we see the individual, not the condition.
Yeah.
And we work with the families on that. We work on the individuals themselves. A lot of stigma is self-stigma.
Right.
Many people, they don't want to be labeled. I used to do a lot of tabling when I was in programs, and people would walk by and they'd see the name mental illness and be like, I don't have a mental illness. I'm not crazy. And then they might say, but I have bipolar disorder. And so it's really helping people to feel like it doesn't matter what the label is. What matters is connecting to the support or the resources or the tools, whatever it is that works for that person.
Right.
So, having a label is not so important, but what is it that you're going through, and how can NAMI support you to go through that?
At Hanley, the vast majority of our patients come in with some sort of co-occurring mental illness. And, we always talk about, was it the chicken or the egg, which really came first? So, this approach that you take is so critically important. I'm just going to toot your horn a little bit. You all have come up with and put some pretty innovative programming on here in Palm Beach County that is not available in the other, 599 NAMI locations. Talk about, yourself a little bit and some of the work that you've been able to bring forward here in Palm Beach. We're very lucky to have you here.
Well, and we're so lucky to be situated here in Palm Beach County with the resources and the support that we have. But we're so excited. Last year, we started to do a pilot on this new family communication series. And now with some new support, we're looking to roll it out and to really be able to offer this on a broader level. But it's called Best Practices for Family Communication. And we're doing a series of different programs. One of those is the Family to Family program I spoke about earlier, which is a lot about communication and understanding how mental health impacts the brain, how medications work on mental health. There is some information on co-occurring disorder and supporting your family member through those challenges. And also at NAMI, side note, we talk a lot about cannabis-induced psychosis or other co-occurring issues within the program. So that we were also offering the course I was talking about earlier, integrative resilience training, which is something that was created here by Cheryl Checkers and Amanda Kopaz. And they created that program so that people could look at, how do I work on those challenges that I faced in my life? How can I build those positive coping skills and overcome those challenges and face it day to day? And, a lot of the family caregivers, they face a lot. And so we help to train them to support themselves and to support their loved one. And then LEAP, I don't know if you've heard of Dr. Javier Amador. He created the LEAP method: listen, empathize, agree, partner. And it's a technique for working with people who are not yet ready to get help, or they don't think that they need help. A lot of the family caregivers who come to us, their loved one thinks that they're the problem.
Right. Of course.
Or, they just don't see it, or they don't want the help. And so how do you, as a family member, deal with that? How do you cope with that? And so we teach a lot of communication skills on just meeting the person where they're at and trying to work with them while protecting yourself and protecting the family and, having those wellness resources. And then the newest one is called Psychosis Reach. And it comes out of the University of Washington. And so we've made a modified version of that. One of our local volunteers, she's a family ambassador with the University of Washington Psychosis Reach program. And so within that program, we talk to family members about what is it like to live with somebody who has psychosis? How do you communicate with them? And it's been a really game-changing program for us. And it's not something that a lot of people have access to. And so after they go through our introductory program, we connect them to the university so that they can then go and take the full program with the University of Washington.
I had not heard about this.
So
yet.
because we were just, doing the pilot last year and seeing how it went. And now it went so well that we're excited to roll it out.
John, let's just stop for 1 second though and talk about this marijuana, cannabis-induced psychosis. Yeah. This is something that we are seeing a lot on Hanley's campus. Do you want to talk about this a little bit, or?
I know that we get calls from family members, and if we ask them, is there drug use involved, they might not think about the cannabis.
That's
part.
Right. Medical professionals might not.
Yeah, that's right.
And so for some people, if they have a genetic predisposition to psychosis, and then you use a substance like cannabis, it can actually trigger those symptoms.
It was about 8 or 9 years ago, maybe even longer, that I saw a patient with cannabis-induced psychosis, which it wasn't even called that back then. There wasn't it. So it was probably longer than 19 years ago. But I remember him very distinctly. It was a young man in his 20s. And he, all reports, he'd had a psychotic break. He's a Wall Street guy, very successful, well-educated, no history of anything that people knew of, but high dose, high frequency THC ever since, he was about 14. And I didn't believe, no one did. He said the only thing, he didn't even drink alcohol, nothing. And the family confirmed it. The drug tests confirm it. Everything. We didn't believe it. We thought, no, there's gotta be something. You're partying with some drug that we're not finding. And because nobody 15 years ago, even less than that
time,
had any idea that the psychoactive drug in marijuana, THC, it is not, your dad's joint anymore, right? So, mom and dad in the 80s were smoking joints and they were getting 5 to 7%, maybe. Today you can go and you can get a vape with almost 100% THC.
That's right.
It is, and the high frequency, high dose we nowadays
have in our inpatient mental health program at least one patient presenting with this almost all the time. Now, the good news is, and these are most all the time young people, usually under 30, they've, we're getting them back, but it's taking months and months. I mean, it is very dangerous. Very, very dangerous.
I think a lot needs to be done for the prevention and the education on it. I think just a lot of people see it as innocuous and don't realize that this could be a trigger and it could be something that is making the problem worse.
Especially when it's called medical marijuana.
Right. But this particular young man, it was a physician, it was a medical doctor that referred him. And in a conversation I had with the physician, very well credentialed, and she said, everything made me think that this was some sort of drug induced psychosis, but the only thing he does is smoke weed. So it can't be that. And so I think the prevention part of this and the education part of this is so critical because there's so much misinformation and misunderstanding. And there was also a lot of fear mongering, right? Yes. So now people are like, I'm not going to listen to anything you people say about, to cannabis. But I couldn't agree more. That's why what you're doing and what we all do together in education and prevention is so critical.
It's critical. Katherine, you brought a book to share with us.
The same thing.
So we have this incredible luncheon coming up. Our keynote speaker is Major General Greg Martin, and he has a doctorate, 2 master's degrees from MIT, an incredible military career. And he credits a lot of that to his bipolar disorder, fueling him along his path. And there came a point where he had to resign from the military. And then he has come out about his bipolar journey. And he wrote this book, The Bipolar General. He's going to be the keynote speaker at our annual luncheon on December 11th. And so
wonderful.
We just want to make sure everybody knows about that and has the opportunity to come out and hear him speak, because it's a really incredible journey. He had a lot of resilience. He's been through a lot and achieved a lot. And I think it is important to, showcase the successes that, many people who have bipolar disorder or other conditions, the wonderful things that they can achieve in spite of or, alongside their condition.
Someone wanted tickets.
That's what I was going to,
Yes,
that's twice.
I know.
We're getting synced up. It's good. If someone wants to.
They can come to our website, NAMIPBC.org.
Okay. All right. Great. How much are tickets?
Well, if you become a NAMI member, you get a discount. We love our members.
Okay.
Yeah.
All right.
So I
Good.
think the member rate is $100.
Wonderful.
Yeah.
It's a bargain.
Yeah.
You get
100%.
to see a wonderful speaker. And is he going to sell books?
He is.
Oh,
Yeah, we'll do a book signing
there we
afterwards.
go.
So I know when I saw him speaking, I thought, wow, this man is incredible. And we went up and met him and he signed my book. And, I just kept thinking about his talk and, what he'd been through and the challenges he'd overcome and, just how much he'd achieved in his life, and invited him down to speak for us. And I was so excited when he said yes. So we're just very excited to have him here. So I think everyone will love him and want to get their book signed by him.
I love it.
So great.
In a time where there's so much divide, right? And there's so much separation and so much brokenness in relationship, the effort to bring our commonalities together, to recognize, like, have these moments that every single one, that we're all on this human journey together.
Yeah.
It is just something that I think is so beautiful. And it's a part of when I think it's not just, helping families who are struggling with mental illness. It really, this whole work really is about restoring relationships and making us all know that we're human.
Yeah.
And I love that. Tell us, we're coming. Oh man, I'm sorry. I'm the bad guy.
No, you're the bad guy.
We're coming to our final minutes. And so 2 things. One, I want to make sure that anything else that our listeners hear, anything else that you want to announce about NAMI, about things that are coming up. So if we've missed anything, I want to give you a chance to say those things so people can know what's coming. And everybody just remember NAMIPBC.org. Go there, because you're going to, if you miss anything, you'll see lots of, things that are coming up. But also, we like to just hear from you, and thinking about the audience. It's a wide range of people, but what is one thing for the last word that you would like for folks to hear from you today?
A lot of times, especially in the family group or the family classes, they say, well, how come mental health isn't treated like other conditions? How come we don't have the same type of awareness campaigns? How come it's not as okay to talk about it? And we're really changing that. I don't know if anyone's heard of the Get Your Green On campaign, but it's this incredible county-wide campaign that we do in Palm Beach County. And it's the whole month of May, we talk about mental health. And so that's just been so heartwarming to see how many people throughout Palm Beach County are now becoming more aware of mental health and recognizing how important it is and important and valuable to talk about it. Then we also have our walk. We have over 700 people come out for NAMI walks, and those are people who are impacted by conditions or caregivers, but also the general public who wants to come out and support. And it is so meaningful to the people that we serve to see all of that support at the walk. So we'd love.
When is your walk?
It's November 1st, so you can come walk off your Halloween candy.
Okay. All right.
Wake up bright and early after Halloween. It's at John Prince Park in Lake Worth.
Oh,
it's a really
wonderful
event. It's a great way to come and meet the community.
I'll be there. November's going to be a good month.
It's going to be a
great start to the month.
Yeah.
I'll be there.
Oh, wonderful. Well, we can't wait to see you. Yeah, Hanley's always there at the walk. We appreciate your support. So we just love seeing all of our community partners. You can come out with your T-shirts and bring signs or whatever you like. So yeah, it's a great way to show, the mental health community that there is a lot of support.
Yes. Yes. This was great. Thank you for coming. We could have kept
talking.
talking for another hour.
I know. And maybe we will just need to do that. That's that simple.
Have you come back?
We really do appreciate you being here, and also all that you do for our community and for kind of the big picture. This has really helped me remember that there's an even bigger picture that you're contributing to. So thank you. Thank you, Dr. Dosicle, as always.
Thank you, Dr. Diamond.
I really like your pink.
Thank you.
What is
Hanley?
It's oh, look at that.
Yeah.
Always
Wait a minute.
brand.
My
How
Hanley
does she
shirt.
get fancy Hanley stuff? All right. And I don't know where any camera is, but for anybody who is watching or listening, it's right there. Hey, how you doing?
Oh, there it is. Okay.
Thank you for being here. We look
That's
forward to
my
seeing you next time on the Hanley Effect.
Bye, everyone.
Thank you for joining us for the Hanley Effect. To learn more about our programs, visit hanleyfoundation.org or call 844-502-4673.